How is action tremor different in Parkinson's disease? Imagine watching someone hold out their hand and noticing a slight shaking, but then when they start to write or pick up an object, the shaking changes or lessens. That's a key clue in understanding tremors in Parkinson's disease. Parkinson's disease is best known for its resting tremor, which usually appears when the muscles are relaxed and the person is not intentionally moving. This tremor often looks like a small, rhythmic shaking, sometimes called a pill-rolling motion, because it resembles rolling a tiny pill between the thumb and fingers. It tends to be most noticeable when the person is at rest and often decreases or stops when they start moving or are asleep. Now, action tremor is different. It happens during voluntary movements or when holding a position against gravity. In Parkinson's disease, action tremor is less common but can still occur. When it does, it often appears as a reemergent tremor. This means that when someone holds their arm out in a fixed position, the tremor might disappear for a moment but then reappear after a brief delay. This reemergent tremor is thought to be related to the same brain mechanisms that cause the resting tremor, and it can respond to Parkinson's medications, which helps distinguish it from other types of tremors. The main difference between the two is when they happen. Resting tremors are most prominent when the muscles are relaxed and not in use, while action tremors happen during movement or when maintaining a posture. In Parkinson's disease, the resting tremor is usually more noticeable and persistent, whereas the action tremor tends to be milder and less frequent. The amplitude or size of the tremor during action is often smaller than the tremor seen in other conditions like essential tremor, which is primarily an action tremor that worsens with movement and is rarely seen at rest. Another important point is how the tremors start. Parkinson's tremors usually begin on one side of the body and tend to stay asymmetrical, affecting one limb more than the other. Essential tremor, on the other hand, tends to affect both sides equally and is more consistent during movement. The frequency of tremors in Parkinson's disease is generally around 4 to 7 cycles per second, similar to the resting tremor, which helps in differentiating it from other tremor types. While resting tremor is a hallmark of Parkinson's disease, action tremor can sometimes be more disabling in daily life because it interferes with tasks that requiring fine motor skills, like writing or holding small objects. Both types of tremors are thought to originate from problems in the basal ganglia, a part of the brain involved in controlling movement. However, some of the neurochemical processes behind postural tremors in Parkinson's may differ slightly from those causing the resting tremor. Understanding these differences is crucial for accurate diagnosis and treatment. Recognizing whether a tremor occurs at rest or during movement helps doctors determine if Parkinson's disease is the cause or if another condition, like essential tremor, might be involved. It's important to remember that individual experiences can vary, and not everyone will have the same pattern of tremors. If you or someone you know is experiencing tremors, consulting a healthcare professional is essential for proper assessment and management.